Hi, my name is Brittany Goody, and I will be presenting the case study for APN 505. Elsie is a 32-year-old female. She's been working in Mexico at Mayan archaeological sites for the last year. For 3 months, she has had a poor appetite, nausea, and abdominal pain, and Elsie has lost 12% of her body weight. 5 days before admitting, Elsie developed headaches, a cough, diarrhea, fever, general malaise, and a rash on her legs. She was flown from rural Mexico and to a hospital in Texas. Elsie was diagnosed with hantavirus pulmonary syndrome, or HPS, a small bowel obstruction second to scariasis, and valley fever. Elsie's work as an archaeologist has exposed her to these pathogens. HPS is transmitted by breathing in dried urine, feces, or saliva from infected rodents when their living areas are disturbed. Ascaris eggs are in soil contaminated with human fecal matter, and valley fever is caused by a fungus in dry soil that turns pathogenic once inhaled into the lungs. In addition to these primary diagnoses, a secondary diagnosis of profound protein calorie malnutrition was also assigned. Shortly after being admitted, Elsie developed hypotension and pulmonary edema and was placed on mechanical ventilation. A nasogastric tube was placed for decompression, and she was started on TPN. Abdominal diagnostic tests were performed and showed the stomach and small intestine dilation and tubal structures found in most of the small bowel. Dilated loops of small intestine were non-peristaltic. Thickening of the terminal ileum wall was believed to be a mechanical bowel obstruction second to ascariasis with associated bowel ischemia. An exploratory laparotomy was performed, finding 100 centimeters of necrotic proximal jejunum, ascaris roundworms, and a basor mass of roundworms along with a duodenal perforation. The entire duodenum and 100 centimeters of proximal jejunum was removed, as well as the basor mass, and an end-to-end anastomosis was created. 4 days post-op, the ventilator and nasogastric tubes were removed, TPN was stopped, and a peg was placed for enteral nutrition. Elsie was treated with an antifungal for valley fever that cleared up the rash, but she developed petechia, purpura, and hematuria associated with disseminated intravascular coagulation, or DIC, which was treated with heparin. Elsie also developed a stage 3 pressure ulcer on her coccyx. Eventually, after passing food trials, the speech pathologist, the peg was removed, and Elsie was scheduled for a future bowel transplant. She was in the hospital for about 1 month. Hantavirus infects the endothelial cells, particularly in the kidneys and lungs. This causes increased vascular permeability that can result in hypotensive shock, which we see in Elsie. 30% of HPS patients die in the cardiopulmonary phase, and patients who survive to the diuretic phase usually improve rapidly. Elsie was admitted to the hospital about 5 days after prodrome symptoms began, and shortly after being admitted, she developed phase 3 cardiopulmonary symptoms and was placed on mechanical ventilation. Elsie later developed DIC. 85% of ascaris cases are asymptomatic. Elsie had abdominal distension, epigastric pain, nausea, and new onset vomiting. When ascariasis causes blockages, it can severely reduce protein absorption. Most cases of valley fever are benign and many are asymptomatic. Others often are misdiagnosed as pneumonia or lung cancer. Patients usually present with general flu-like symptoms, and the rash on Elsie's leg is a characteristic of valley fever. Elsie's poor appetite was due to the ascariasis infection. Bowel obstructions caused by ascariasis inhibit protein absorption. The combination of factors such as insufficient nutrient intake, bowel obstruction due to ascariasis, and a past terminal ileal resection have all contributed to Elsie's diagnosis of profound protein-calorie malnourishment. During her hospital stay, Elsie developed a stage 3 pressure ulcer. Protein malnutrition has likely contributed to the development of the pressure ulcer, as well as the severity of her diseases. Elsie has an active lifestyle. She exercises daily and enjoys mountain climbing and treasure hunting. Elsie follows a strict vegan diet and uses a personal chef to prepare her meals. She uses an insulin pump to manage type 1 diabetes. Elsie is deficient in vitamin D and B12, so she takes those supplements. Elsie seems to be willing to follow nutritional guidelines when she is informed about what she should do. In her recent hospital stay, Elsie was TPN for 4 days while on a ventilator. Once that was removed, a peg was placed and continuous enteral feedings using vital peptide 1.5 cal was started. Vital peptide 1.5 cal focuses on malabsorption with an 18% protein. A speech pathologist performed a food trial and found no signs of dysphagia, so the peg was removed. Such tests such as high potassium, BUN, and creatinine tests indicate kidney issues. HPS inhibits kidney function in its early stages and then causes diuresis in later stages, so it's likely these tests are related to the hantavirus. Typical features of HPS include thrombocytopenia when platelets are below 150,000 units, also high creatinine, low albumin, and high white blood cell counts. High CRP levels indicate inflammation, and low albumin can indicate malnutrition in an inflammatory state. Vitamin D levels are also low. Elsie comes from an aristocratic family. Her parents died when she was young. She is single and has a PhD in archaeology. She has no drug or alcohol use, and she is a vegan. Past medical history includes type 1 diabetes, HO terminal ileal resection secondary to Crohn's disease, and hyperthyroidism, along with a vitamin D and vitamin B12 deficiency. Type 1 diabetes is managed with an insulin pump, and Elsie takes supplements for vitamin B12 and D deficiencies, but ran out of vitamin D supplements on her last expedition. Most of the digestive system issues have been due to scariasis, and since this has been treated, nutrition will focus on compensating for the short bowel and previous malnutrition. Proximal small bowel removal can result in reduced absorption of vitamins and minerals. The terminal ileal resection can also cause protein and fat-soluble vitamin malabsorption, along with micronutrient deficiencies. Cardiopulmonary issues revolve around hantavirus. Foods that promote cardiovascular health and platelet function may be beneficial. The convalescent phase of HPS causes weakness, fatigue, and abnormal distribution of gas in the lungs. This can be associated with an increase in energy and protein expenditure. Protein malnutrition and vitamin C deficiency are linked with pressure ulcers, petechia and purpura are related to DIC, but they can also be linked to vitamin C deficiency. Purpura is linked to a vitamin K deficiency as well. Protein malnutrition can be a big contributing factor of illness severity, which can be shown in low albumin levels. My nutrition diagnosis is inadequate protein energy intake as related to poor absorption of nutrients due to ascariasis, as evidenced by reported poor appetite and an unintended weight loss of 12% of body weight in 3 months. An increase in protein consumption to between 80 to 107 grams per day is suggested, as well as a total daily intake of 1924 calories per day. Elsie and her personal chef should be educated on how to pair foods for complete proteins in a vegan diet. In conclusion, Elsie has a severe protein deficiency due to ascariasis that has contributed to her body not being able to defend against common pathogens. Treatment going forward will focus on increasing complete protein intake as well as calorie intake, and it will include her personal chef for support. Here are my references. And thank you for watching my presentation. Have a good night.